More than 900 million dogs lives in the world. Most of these dogs have never been owned by humans. Dogs' most common response, when approached by strangers, is to run away. But sometimes they respond aggressively. Even family dogs sometimes bite to their owners. Most of dog bites are harmless, but sometimes they can cause severe health results. In rare cases, even death. Some breeds considered more aggressive, for example Rottweiler and Pit Bull. But any dog may attack when threatened. It is topic of debate if the breeds are aggressive, or the owners raise them to be aggressive. A large percentage of dog bite victims are children. In younger children, the most frequently biting areas are the head, face, and neck. For adults, limbs are most common areas of bite. The incidence of dog bites peaks during the spring and summer seasons. They are often unprovoked. All dog bites carry a risk of infection. But most important issue you should pay attention is risk of rabies. Rabies is almost invariably fatal, so even seemingly minor bites should be taken seriously. If the biting dog presents any abnormal behavior, such as hypersalivation, seizures, paralysis, and irritability, also if dog is unfamiliar and you cannot observe her for next following days, then rabies vaccine is required. Rabies vaccine should be administered as soon as possible. If the patient was previously vaccinated for rabies, recent years, vaccine still needed. What to do first to prevent rabies? Cleansing significantly lessens the risk of rabies. Flushing the wound under a running tap water for several minutes, washing with soapy water or detergent, and particularly using wound disinfectants, such as 40 to 70% alcohol or povidone iodine, is recommended. If no risk for rabies, for example familiar healthy vaccinated dog, then optimal treatment of dog bites still starts with generous irrigation of the wound with saline solution or tap water. Debridement, including removal of foreign bodies and devitalized tissue. Surgical closure of the wound is not recommended in most cases because it increases risk of infection. If wounds in high-risk locations, such as face or genitals, should be referred for surgical consultation. Radiography is recommended for wounds near joints. Although tetanus after animal bites is rare, all guidelines in common use advise tetanus prophylaxis. Children with facial or cranial bites need cervical immobilization until cervical lesions are excluded. Big bites have more risk of bacterial infection. Most dog bite infections are polymicrobial, but more dominant bacteria are Pasteurella and Bacteroides species. If infection develops within 12 hours after bite. If more than 24 hours after the injury, more likely batteries are Staphylococci or anaerobes. That's why infection prevention with antibiotics is important, especially in case of big bites. All bite wounds after primary closure. Puncture wounds. Bites to hand and wrist. Crush wounds with devitalized tissue. Dog bite injuries to the genitals. The first-line choice of antibiotic is amoxicillin clavulanate. Doxycycline plus metronidazole is also useful. Erythromycin or flucloxacillin should never be used alone because as Pasteurella infection is usually resistant. And at last, several advices how to avoid dog biting. Don't approach an unfamiliar dog. Don't panic. Don't run from a dog because they have chase reflex. Don't disturb a dog that is sleeping, eating, or caring for puppies because they have defense reflex. Don't encourage your dog to play aggressively because dog can't prevent unintentional biting during play. Don't allow small children to play with a dog unsupervised. Always report dogs that are behaving strangely. Always ask before approaching or touching someone else's dog. Don't attempt to break up a dog fight.